Med Basic 21.
Now we shall discuss what is antibiotic, classification of antibiotic, how antibiotics act against pathogen.
Antibiotics are used to treat or prevent some types of bacterial infection. Antibiotics are produced from living organisms, like fungi, bacteria, and actinomycetes, which are used to kill or inhibit the growth of bacteria at low concentration.
Now we shall discuss the classification of antibiotics.
Antibiotics are classified as below, according to power: bacteriostatic and bactericidal. 2. According to spectrum of activity, bacterial coverage, broad spectrum and narrow spectrum. 3. According to chemical structure or mode of action, beta-lactam or cell wall synthesis inhibitor, both penicillins and cephalosporins, protein synthesis inhibitor, macrolides and aminoglycosides, nucleic acid synthesis inhibitor, fluoroquinolones.
According to chemical structure, a mode of action, antibiotics are classified as A. Beta-lactam or cell wall synthesis inhibitor, both penicillins and cephalosporins. This type of antibiotics inhibit the cell wall synthesis of bacteria by inhibiting the transpeptidase enzyme. For example, cephridin, cefuroxime, cefadroxyl monohydrate. These antibiotics, beta-lactam or cell wall synthesis inhibitor, are bactericidal.
Protein synthesis inhibitor, macrolides and aminoglycoside. This type of antibiotics inhibit the protein synthesis of bacteria by inhibiting the 50S, macrolides, or 30S, aminoglycosides, ribosomal subunit. For example, erythromycin, roxithromycin, azithromycin. These antibiotics, protein synthesis inhibitors, are bacteriostatic.
Nucleic acid synthesis inhibitor, Fluoroquinolones. This type of antibiotics inhibit the nucleic acid synthesis of bacteria by inhibiting the DNA gyrase and topoisomerase 4, combinedly called topoisomerase 2, enzymes. For example, ciprofloxacin, levofloxacin. These antibiotics, nucleic acid synthesis inhibitors, are bactericidal.
Antibiotics are classified as below, according to power: bacteriostatic and bactericidal. 2. According to spectrum of activity, bacterial coverage, broad spectrum and narrow spectrum. 3. According to chemical structure or mode of action, beta-lactam or cell wall synthesis inhibitor, both penicillins and cephalosporins, protein synthesis inhibitor, macrolides and aminoglycosides, nucleic acid synthesis inhibitor, fluoroquinolones. B. Bactericidal. A substance that kills the bacteria is termed as bactericidal. Like all cephalosporin antibiotics etc., bactericidal antibiotics kill bacterial cells directly.
According to spectrum of activity, bacterial coverage, antibiotics are two types like broad spectrum and narrow spectrum. A. Broad spectrum. If a single antibiotic covers a wide range of pathogenic bacteria like gram-positive, gram-negative, atypical bacteria and even beta-lactam-resistant bacteria, it is known as broad-spectrum antibiotic. Like cephalosporins, broad-spectrum antibiotics are active against a wide range of bacterial species. These antibiotics act on structures or processes that are common to many different bacteria, such as the components of the cell wall.
B. Narrow spectrum. If a single antibiotic covers selected group of bacteria like gram-positive or gram-negative or atypical bacteria, it is known as narrow-spectrum antibiotic. Like vancomycin, antitubercular drugs, etc. Antibiotics with a narrow spectrum of action can kill only a small number of species of bacteria, maybe even just one. Narrow-spectrum antibiotics tend to be very specific and act on a molecule in the metabolism of one particular type of bacteria that is special to that species.
Now we shall discuss how antibiotics act against bacteria. How antibiotics act.
Antibiotics shows their activity against bacteria by 5 mechanisms like
Inhibition of the growth of bacteria by competitive antagonism. Inhibition of cell wall synthesis. Alteration of the cell membrane function. Inhibition of protein synthesis. Inhibition of nucleic acid synthesis.
Inhibition of the growth of bacteria by competitive antagonism. PABA, para-aminobenzoic acid, is essential for bacterial growth. Like cotrimoxazole is similar in structure to PABA. Bacteria combine with cotrimoxazole in confusion. As a result, growth is inhibited.
Inhibition of cell wall synthesis. In normal dose of antibiotic, the cell wall of bacteria cannot be synthesized. Antibiotic inhibits the required enzyme by binding with it. As a result, formation of peptide, amino acid, cross-bridges and bonds between amino acid and muramic acid are inhibited. Thus the cell wall becomes weak, which causes lysis of bacterial cell. Like Penicillins, vancomycin, Cephalosporins.
Alteration of the cell membrane function. Some antibiotics work by altering the permeability of cell membrane. They cause cleavages, openings, in cell membrane which results in loss of cell contents. Like polymyxins.
Inhibition of protein synthesis. Some antibiotics act on bacterial ribosome. By combining with ribosomal subunit, 50S or 30S, they inhibit the protein synthesis in bacteria. Like Macrolides, Aminoglycosides, Tetracyclines.
Inhibition of nucleic acid synthesis. Bacterial DNA synthesis is inhibited by some antibiotics by inhibition of the DNA gyrase and topoisomerase 4, topoisomerase 2 enzymes. Like Fluoroquinolones, nalidixic acid.